for today's video, I'm going to show you how to take the 7 vital signs. My name is Jen, and I'm your nursing assistant for today. So, why we are taking vital signs from the client? Basically, we started from the Muse report upon admission, after operation, or after delivery of the patient. So first thing to do, I already make sure that the functionality and cleanliness of the equipments that were going to be needed are all safe to use. So we have here thermometer for taking the body temperature. We have also something for oral, for axillary, and also for rectal. We do have also the tympanic thermometer and infrared. Next is we do have also here the pulse oximeter for taking the oxygen saturation for the body. And we do have also here the stethoscope for taking the heart rate. Next is I do have the machine with me for checking the sugar level of the body. I do have the strips. Okay, I've already checked the expiration date. I do have also the machine, the clinometer itself, and then I have the lancet holder plus also the lancet needle. Last would be is I have the sphygmomanometer for taking the blood pressure. How to check the body temperature? First, we do the hand rubbing. Okay. First, by using the oral thermometer, position the patient on a proper seat and then make sure that the patient didn't eat anything 20 minutes prior to do the taking of body temperature. She didn't eat anything, she didn't chew any gum, she didn't smoke, drinking hot water or anything. By using the oral thermometer, first, let the patient open the mouth, okay? And then raise the tongue up and put the probe tip of the thermometer. Let the patient close the mouth and press the button and wait for the beep sound. And then sanitize the thermometer and then record. Next step is for taking the axillary thermometer. Make sure that the patient's armpit is dry by the towel. Okay. Make sure you dry it, and then put the thermometer, and then let the patient put the arm on the shoulder, and then press the button of the thermometer, and wait for the beep sound, and then remove. Okay. And then sanitize the thermometer, and then record. For taking the rectal body temperature, what you're gonna do is ask the patient on a position, seems position, sided, okay? Make sure that the buttocks it's lifted up, and then put a jelly or lubricant on the tip of the rectal thermometer, and put it half inch, and then press the button, and then wait for the beep sound. And then remove the thermometer, and then sanitize or clean by using soap, and then record the results. And in the hospital, they have also the tympanic thermometer by using from the ear. So basically what you're gonna do, put the cover on the tympanic thermometer. What you're gonna do, stand on the front of the ear of the patient, put the tympanic thermometer on the ear of the patient, pull, and then press the button, and wait for the beep sound. Remove the cover, eject the cover, and also write the result. Infrared thermometer, what you're gonna do, at least 2 to 3 inches on the forehead of the patient. Push the trigger button and wait for the beep sound. And then after that, you write the result. So for taking the heart rate of the patient, what you're gonna be needing is a watch with you. Okay. All you have to do is using the index and middle finger, locate the radial pulse. Okay. And then put it in the hand of the patient. Count the pulse of the patient 30 seconds by 2 or 1 full minute if there's any irregularities of the pulse of the patient. And also, by taking also of the respiratory rate of the patient, pretend that you're still taking the pulse rate of the patient. Do the same thing, 30 seconds multiply by 2 or 1 full minute if there's any irregularities of the breath of the patient. And remove the patient's hand. Let her to rest. So for taking off the heart rate of the patient, all we're gonna be needing is the stethoscope. So first thing to do is you put the stethoscope on your neck first, and then put the diaphragm 2 to 3 inches below the apial part on the lower left breast of the patient. Count full 1 minute. And if there is any irregularities, note it and document the result. Next is for taking the oxygen saturation of the patient. What we're going to be needing is the pulse oximeter. By taking the patient or by using the patient's index finger or the middle finger, make sure you make it really warm and then insert on the oximeter and then press it. Wait when it's the result shows and then document the result. And sanitize as often as is needed. Okay. So the fifth actually vital signs that I'm going to demonstrate to you, it's all about pain. So for the pain, you can assess the patient by using the visual acuity severity. If the patient doesn't have any complaint, you can rate the patients from 0 over 10. And if the patient has actually complained, you will gonna see it on her face by using the cold spa. Cold spa means C is for characteristic of the pain. Is it if it is like from burning, from stabbing, from aching. And then O is for onset. Onset is for like if it is chronic, if it is already been long time. Location also of the pain. If it is headache, frontal, temporal. And then also duration. If how long already is the period of the pain. S is for severity, chronic or pneumonic. And then P is for pattern. If it is on and off, it is continuously. And A is for associated symptoms. So, that is for the assessing of the pain. And then, our sixth vital signs is taking the blood pressure of the patient. Make sure that the patient didn't do anything, any type of like dialysis, CAS, not done any breast surgery, IV infusions, and make sure also that the patient is rested for 20 minutes before taking the BP. Plus, if you're also not sure, ask your RN which arm that you need supposed to take the blood pressure of the patient. Okay, then position the patient on a 90-degree arm on the table. Okay, and then by taking the sphygmomanometer, make sure that it is actually inflated. Expose the patient's arm and then find also 1 inch the radial pulse of the patient, 1 inch below the elbow. Okay, and then snuggle, okay. One inch, and then put the gauge up. Okay, and then close the bulb and start to do inflate, and then by using the index and middle finger, find the brachial artery and start inflating. And if you don't hear the brachial, put the stethoscope 1 inch above level. Start to do the inflate slowly. The first beat that you're gonna hear, that's what you call systolic, and the second is what you call diastolic. Patient properly, and then record the result. And final vital signs that we're gonna do is how to take the blood sugar level of the patient. Next is you have to put a gloves. At the moment I don't have the gloves, I'm so sorry. I will just do the hand rubbing. But the proper should be wearing gloves. First is you have to check the strips if it is up to date. I check already if it is expired upon opening. Okay, we'll be needing one. Make sure that it's actually matched on the machine. Okay, first is remove the cover of the lancet. Okay, and take one lancet, insert it, and then twist it. Remove the cover and don't throw the cover of the lancet. And then put the lancet holder. You choose which number to be taken. How deep is the needle to be pricked? Pull the prong. Okay. Pull the plunger. Take the cotton and put the alcohol. Choose the finger that we're going to be pricked. Okay. You sanitize it with alcohol or any alcohol swabs that you have. Let it dry. Okay. And then open the machine. You insert first the strips and then open the machine. And then when it's already dry, try to pull the plunger and then put it on the finger that you've been chosen to be pricked, and then you press the button and drop a blood on the machine, and then wait for the result of the machine. It appears, and then press lightly on the pricked finger, and then put any bandage or any plaster, and then documented it, and then switch off the machine. Remove the strips, and then put back this cover of the lancet, and then eject it on the sharp container along with the strips. Okay, and then cover the lancet holder, and then do the hand wash or hand rubbing, or even remove the doffing of the non-sterile gloves. But at the moment I don't have the gloves, so I have to do the hand washing, supposed to be. Yeah. So here are the 7 vital signs that we discussed. Make sure that we all documented it, and if there's any irregularities, you report it to your registered nurse or nurse in charge. And that's it. Thank you so much, and God bless everybody. Keep safe.